Good morning, folks. Sorry for the delay in getting started this week. Welcome to the Boston Healthcare Technology User Group. Happy to be here again. And again, thank you for making time for our stream. Typically, we try to start right on time. We just had some technical glitches this morning. I'm traveling on the road, and that brings a new level of complexity to doing the meeting, if you will. So I'm excited to talk to you about a couple of things this week. As you know, the topic of the meeting is actually centered around the industry cloud battleground week and the acceleration economy. And so I thought what we could do is start there. I'm really excited to announce that I've taken on a new role as an analyst for the acceleration economy. And so I'm sharing the website here. You should be able to see it on your screen. So if you go to accelerationeconomy.com, what you'll find is it's interesting. There's a ton of resources here. There's a team of analysts that are reporting on different sections of the industry clouds, if you will, and topics that are related to not only cloud technology, but just targeted towards the C-level suite in making decisions on topics like healthcare, right? And that's why I wanted to talk about it during this meeting, is because of my role as a healthcare analyst. And so it's really it's an honor to be part of the network. And you can see actually if I scroll down and look at a couple of the recent posts, for example, there's an interview with ServiceNow, who just implemented a vaccine system for 1,500 employees. That's actually something we just did in the last couple of weeks as well. We released a vaccine platform as well at Real Activity. But so, if you dive in, you can actually see there's a bit of healthcare content that's accumulating here. And I think one of the things that you might be interested in noting is that there's actually a digital event happening next week. It's the Industry Cloud Battleground Week. And so on Tuesday is the healthcare day. And so I'm actually part of the roundtable discussion, and I'll be commenting on some of the discussion as the vendors present on their industry cloud. So you do have to sign up. It will require giving a name and an email. But in exchange for that, it's actually, what I'd like to point out is that we have some really quality resources speaking. You can see we have Tom McGinnis, who's a corporate vice president for cloud healthcare and life sciences at Microsoft, is going to be one of the presenters. Jen Roth, who's in charge of marketing for the healthcare at Microsoft. And then from Workday as well, the senior industry solution manager from the healthcare sector from Workday, VP of industry solution marketing from Workday, the senior director of industry strategy from Workday. This must be a new ad. I didn't actually see this yesterday. We've actually got some folks from Salesforce now. So you can see Jason Marshall, it looks like, Chris Salinas, all senior directors. So that they made a big announcement. They're partnered with Salesforce now, and collaborating on bringing industry cloud integrated with Cerner systems, which as you can imagine is a pretty big announcement, right? A pretty big partnership. So again, that's new. They must have just added these folks to the discussion this week. And then so we've got somebody here from MMIT Health, Humana, and then we've got a couple of representatives from Google Cloud as well. And then Oracle Cloud is going to be represented, and then SAP. So it's a really quite a powerful and impressive list of speakers, if you will. And so that's one of the reasons why I was excited to share this. And so it is a digital event. It's free. There's no sign up or cost or anything. It will, it requires you to sign up. We're focused on the healthcare industry, not just in the user group, but in our day-to-day lives and in our company at Real Activity. So I'm only focused on Tuesday, the healthcare day. And again, I'll actually be participating in the roundtable and interviewing folks. But there are other industry days as well. So if you have other friends that are in different industries, it might be worth sharing. So again, this is the acceleration economy. I'll probably talk about this from time to time as I present at the user group, which will probably be less and less. I'm happy to say we've actually have gotten some traction, and we've got a bunch of speakers signed up now through January to continue presenting on technology and showcasing healthcare technology. But we'll also have our roundtable discussion meetings like this, which will be 20 to 30 minutes, where we just talk about what's new with the user group and the direction we're heading in. And so in the spirit of doing that today, I thought I would, again, call out the Acceleration Economy Network. I'll probably continue to talk about this from time to time. And I would encourage folks to try to make this, this Industry Cloud Battleground week. It's November 15th. The Healthcare Day will be on the 16th. And so with that said, I'd like to talk about a couple of other things from a technology perspective. And the first is this interesting article I found from Pew Trust and Research, which talks about interoperability and the FHIR standard in healthcare. It's fairly recent. It's from January of this year, so it's about 9 months old. But most of the research in here is still relevant. I was actually going through this over the past couple of days, and I just thought there was some really interesting information in here about FHIR services, in particular, like just how many healthcare organizations are set up in a position to take advantage of FHIR services and the APIs for healthcare integration. And so for those that are not familiar with, with the FHIR APIs, I guess the fastest way to describe it is essentially, we have now a set of APIs that can be used to extend our patient data, if you will, up through to the cloud or industry cloud, right? So and currently this is happening in a read-only mode, right? So the idea is that, especially in the last year and a half, there's been this huge need to surface patient data up to things like patient portals, scheduling workflows, right? A lot for telehealth reasons. More and more over what we saw over the past year and a half was this explosion in remote care. And so, of course, that implies that we need access to the patient data that's in our in our EHR, our electronic health record, that's usually on-prem. And so the standard way of doing this is through the standard that evolved is FHIR. It's an evolution of HL7 is the best way to think about it. And most of the vendors have a FHIR implementation, right? And certainly all the big ones. So if we look at Epic, who has 52% of the market share in the electronic health market, if you look at Cerner, which has a huge percentage of the rest, and then if you look at the big industry health cloud vendors, I think of Google, Microsoft, Oracle, Salesforce. They all have, and even Epic has its own FHIR service. If you look at Epic Share, it's actually built around FHIR services and using FHIR services to integrate. So, in a sense, you could say that because FHIR is enabled in these EHRs, in a sense, it's available to almost all of the healthcare vendors, right? And so that was something that I found of interest in reading reading through this article. What's also really interesting is, so here's the part where it talks about the federal regulations. So there were some new regulations that were introduced in 2020, and I think this was mostly to help deal with pandemic issues and helping us surface this data up to the cloud. What's worth noting is that they have a new set of regulations that are scheduled to take an effect in 2022 that will actually introduce write capabilities. So I think this is really fascinating because it should open up even more use cases in industry cloud and in healthcare technology, right? So now we have read capabilities, so we can surface data up and we can display it to patients in portals. We can display it for remote telehealth visits, et cetera. We can display it for scheduling purposes. But soon what we'll start to see is a lot more use cases around this write capability using the FHIR APIs. And so what I'll do is make sure that we publish this link with a PowerPoint deck from today. We'll make sure it's available. For those of you that are new to the meetings, remember we put all of our content in our Discord group. By the way, we actually it's worth noting we actually have a new website as well. So if you go to BOSHUG, BostonHealthcareUserGroup.com, what you'll note is it'll bring you to a link tree. And from here, you can quickly link to our mailing list. Please join our mailing list if you haven't already. The link to the meetup group, you can register to speak. We're always looking for new speakers. And then down here, we've got the link to our Discord group, and that's where we'll have The PowerPoint slides are up there from the past meetings, and I'll put up a PowerPoint deck from today's meeting, and it will include that link, as well as a link to the Acceleration Economy, the Industry Cloud Background Week, and the article that I just shared with you. So you'll find all of those things in the PowerPoint deck that'll be up in the Discord group by the end of today. And then one last thing I wanted to share with you is that we've started to dive into customizing the return to work platform for Microsoft. So this is something we're proud of. We actually started customizing this and extending it for our clients, and it's been sort of neat to work with. So I thought I'd share this with you. The return to work, it's actually a set of applications. So what you end up doing, if you wanted to use just the out of the box templates, you can install these through AppSource, and there's 3 applications, if I remember correctly, and 3 Power BI reports that get installed. Now ours is going to look a little bit different because the ones that come out of the box they're pretty vanilla. They're just really meant to this as a starting point to get you going. And we've actually taken the next step and started customizing these quite a bit. But what you're looking at here is, so 3 of the apps that you'll install, 2 of them will be model-driven apps. So you can think of these, for those that are not familiar with Power Platform, you can think of these as built on the traditional entity framework, if you will. So they more or less like ERP type apps, right? So, and that would be the model-driven side of Power Platform. And then we have this other type of app, which they refer to as Canvas apps. And Canvas apps are more like your traditional, what you see is what you get, or rapid application development environment might be a better way to describe it. I think WYSIWYG is more appropriate for the web, right? And so maybe we'll call Canvas apps, a rapid application development environment for low code. It's created for low code. And so that's what if we actually, let me start with the model-driven apps first. So if we look at the model-driven apps, you can see there's one for facilities management, where we can set up our facilities around the world. We can set up facility groups, facility types. And then what we can do is we can manage employee attestations. So the one that I wanted to demonstrate is the one for vaccine attestation, since it's just a hot topic right now, and a lot of people have to deal with this. And so what you can do is you can actually use again, this is our customized, version. But what you can do is the employees can use the Canvas app to request a day pass, or they can also do their vaccine attestation here. So it actually gets filed electronically. And then, there's a place where they can actually, give some sentiment, right? How are they feeling today? And so all of that stuff goes into, Dynamics and Power Apps, and then it can be surfaced up through these dashboards that can be made available for leadership. And so, I pulled up, here's the Return to Workplace Leadership report. It'll take just a minute to load here. I've got a slow connection. And so this is, an example of one of the dashboards. And then we've got another one here. And so, again, I know this is a little bit quick, but as sort of an extra bonus today, I thought I would share it with folks because I know this is something a lot of companies are dealing with. And again, there are templates for this that are, that are free to download. We've already taken sort of the next step and added quite a bit of customization, and we've been integrating it with ERP for some clients, and also just making it more widely available. So it's one of the projects we've been heads down in this week. And so with that, I think I'll conclude the meeting. I want to be, succinct this week. Again, I apologize for the delay in starting, and I apologize if there's any connectivity issues. I am traveling this week, and I am experiencing just a little bit of connectivity issues. And to make up for that, I will make sure that I publish all the links that I shared today. I'll make sure that they're nicely tucked into a PowerPoint that will go up in our Discord group. For those that are new to the meeting, check out the Discord group. We have our PowerPoint slides from previous meetings there. Also on our YouTube channel, we have the videos from our previous meetings as well. So if you want to check out some of the YouTube videos, I'd encourage you to check that out and subscribe to our list as well. And with that said, I think I'll sign off and wish everybody a great week, and thank you for being here. Cheers.